and this part is the cornea, and this cornea is supposed to be transparent, but because the eye has been preserved in chemicals, so it doesn't look transparent. And behind that you will see some dark area which should be iris. Now these here you can see some fat, you can see some muscle here, right? Color differentiation here. But you don't need to identify these muscles or anything. So what you need to do is just trim this fat from here. And you don't need to be super clean on this thing here. Just trim it. And again, you know that this tissue, when you put it, doesn't go into the sink, even tiny bit, so it can clog. Okay. So behind this, if on the back side, if you put your fingers like this here, you can feel the optic nerve is hard, is rigid. You can feel it. To see the inside, all you have to do is give a cut around the eye, about 1/3 the distance from the cornea, all around. So what I like to do is, because the sclera, sclera outside layer is tough. So I just like to give one slit with this pointed, with the point here. And then once I give that slit here, it's kind of tough. So what I can do is, after I give a cut, then I like to go with the scissors here. I gave a cut here, see this, right? You can go all around with the blade if you want to, but I feel more comfortable with the scissors. And where is that cut? Did I lose it? Here. I'll go all around. Inside the fluid, aqueous humor is supposed to be clear, but because of preservation, some of the black color will leach out. And I can leave it attached a little bit here. This kind of dried out. I think somebody left it outside. It's kind of dried out, but you can see this here. You see here the lens.
Oh yeah.
Right? See the lens here? And notice this white thing here. This is the vitreous humor. Looks like a gel. See this white thing here? The vitreous humor. Right? And if I remove these things here, outside, if I leave it outside here like this, then do you see here the pupil? Right? The pupil in the center. And around the pupil, you will see 2 layers of black rings. The one which is immediately around the pupil is the iris, correct? So let me try to invert it like this. You can see one layer has got radiating ring-like things. So this is the iris here, right? This is the iris here, correct? And then outside that you see these radiating rings here, radiating fibers-like thing, black. This is, you can call ciliary processes or ciliary body. All right. So can you distinguish the 2 layers here, right? Is that okay? All of you? The 2 parts here. So the thing is, around the pupil, it has to be iris, right? And the other thing is the ciliary body, or you can call ciliary processes. And then, now you see here the white layer here, very thin layer, whitish. This whitish layer here is the retina. It is very thin. I've shown you all those layers of photoreceptor cells and all those layers of ganglion cells and bipolar cells. They're all in this thin layer. And I took water. I could better use some kind of a brush or something. to separate this layer from the choroid, which is a dark layer, right? Middle layer is choroid. So when I separate that, it is so delicate, the moment I touch it, it is going to break. I should have fine hairbrush. You see it separating? You see this floating layer here? All of you see this? So this floating layer here, how thin it is, see this? This is the retina. And the dark layer is the, black layer is the choroid, right? Can you see that? Right? Retina and the choroid. And in the choroid, in this animal's eye, there is something special we don't have. And that special something is, let me remove this retina here. I'm going to break the retina to show you the inner part here. You see something shiny? You see that? That shiny thing here is for the animals to see in the dark. Their eyes shine in the dark because of this thing. And this is called as tapetum lucidum. This, you see here? You see this thing here? Right? All the white and the blue and the green and yellow part here.
What kind of cells then are in there?
These cells are more for rod cells. They help the animals to see better in the dark. There's some special things here. We don't have that. And the name is tapetum lucidum. And you can see here, if you really closely see, you can see some kind of optic, this blind spot here. You can see how retina is attached here. If you, maybe you can see or not, see this? It looks like, see those who are near, you can see that. See the retina is attached here. See it attached here, right? So that's the blind spot. Okay, so this is about the dissection. In the exam, you will not be dissecting, but I will have dissected eye to ask you all the parts, just like the brain. Any questions? Okay.